today we will present about Universiti Malaya Medical Center. So for the first is introduction. As you can see above, introduction for UMC. UMC is formerly known as University Hospital, which is a government-funded medical center that is created and grew in Singapore 1949 as a national institution to serve the higher educational needs of the Federation Malaya and Singapore. The government of Malaya expressed a desired change of the status of the Kuala Lumpur division to a national university, which is to promote shortage of medical doctors in Malaya. In this year, where University of Malaya is lack of medical doctors, so Singapore have put University Medical Malaya Center to people especially in the Kuala Lumpur. University Malaya Medical Center was officially opened by His Majesty the Yang Di-Ketua Agung Duli Yang Maha Mulia Sri Paduka Baginda Yang Di-Ketua Agung Tuanku Ismail Nasaruddin Shah. Siapa nak scroll slide ni? Siapa nak scroll slide? Okay, so for the first, you can see here, this is the picture of University Malaya Medical Center in the previous years. University Malaya is situated inside the Great Valley Mega Mall, only 20.5 km away. So this is the UMC quick statistic. This is from the UMC website. As you can see here, the total patient from 2009 to 2018 is increased from 926,000 to 107 million. So this is UMC quick statistic for number of inpatient and outpatient statistic 2009 to 2018. We can see that they are increasing from 2009 to 2018. Okay, next is vision and missions. For UMC, University Medical Center is committed to become a multifaceted department of excellence in all four sectors, which is clinical care, research, teaching, and service to the University Malaya and the radiology profession. For the vision, UMC is trained practitioner and the next leader and advance the imaging science, which improve the human condition and continually re-evaluate and improve all aspects of practice. Next is hospital and department policy. As you guys know, hospital is the place where patient who in needs will get help. So, UMC provides and maintains a safe and healthy environment for all the employees, students, patients, contractors, and the public against any possible risk. Means here that UMC is open to all races and religion. UMC will utilize all effort and potential of every resource to produce the highest quality in education, health service, research, and administration. The policy encourages the staff to realize and giving commitment towards continuous improvement through the implementation of current quality system of University Malaya Medical Center. Okay, as you can see here, this is the hospital organization chart of UMC.
Let's proceed with chapter 3. The department of the department in University of Malaya Center. There are two departments. First one is Department of Medicine. The Faculty of Medicine of the UMMC was established in the year 1963. The Department of Medicine is one of the academic departments of the faculty associated with the clinical teaching facility at the University Malaya Medical Center. The Department of Medicine provide the following clinical service of patients: outpatient, inpatient, daycare services as detailed separately. Second one is subspecialty care consultation service to other disciplines in the hospital as detailed separately. Next one is faculty Department of Surgery. The Department of Surgery is the major department of the University of Malaya. It was established in 1965. The department played an important role in the university as a major referral center of Malaysia. The Department of Surgery provide the following clinical services to all surgical patients. The service are open to all patients from newborn and adult, which is outpatient clinics for elective and follow-up cases. Second one is inpatient services such as pre and post-operative care. The third one is surgical emergency, and the fourth one is surgical daycare services, which is daycare services and daycare surgery. That's all from me. Thank you.
Assalamualaikum. My name is Maizatu Sheraz. So I want to present about Department of Pediatrics. So this department manages a total of 6 children's ward and a pediatric daycare ward. The objective of the department is to be the best department in handling all level of children carriage from newborn up to 18 years old. This is to ensure all children in region in Malaysia to get the best quality of care. Next, the Department of Orthopedic Surgery. The orthopedic surgery, being a part of the UMMC, plays a major role in management of patients who are
Assalamualaikum, my name is Iqbal. So we go next to orthopedic surgery. As we know, UMMC is a big hospital, so they have an orthopedic surgery. So the orthopedic surgery, being part of the Universiti Malaya Medical Center, plays a major role in management of patients who are channeled from walk-in clinic. They can walk in to the clinics, accident or emergency unit, primary care clinics, and also elsewhere. Both general practitioner and specialists, the department has played a major role in the development of orthopedic surgery in the country, in Malaysia, having pioneered several new treatments and operations over the years. So the service is such as scoliosis clinic, scoliosis for orthopedic for kids, and orthopedic pediatric clinic, adult reconstructive clinic, sports clinic, hand and microsurgery reconstruction clinic. Next is spinal clinic, orthopedic general clinic, outpatient service, and 24-hour service in trauma and emergency unit. Next is trauma and emergency department. In UMMC, it is located at ground floor because it's easier for the ambulance to go to the emergency. Emergency medicine is a branch of medicine that is practiced in hospital emergency department. Emergency medicine focuses on diagnosis and treatment of acute illness and injuries that require immediate care, such as accident, motorcycle with lorries, for example. And emergency physicians rarely provide long-term care. However, they can still provide treatment in the aim of improving long-term patient outcome. Okay, the trauma and emergency department provides pre-hospital care service, which include number one is ambulance service. Second one is medical direction. Medical direction is provided by Medical Emergency Coordinating Center, MECC, and UMMC Dispatcher Unit, Mass Casualty Incidents and Disaster Management. Last one is medical standby. Hospital-based service, triage service, emergency clinical and social care, observational medicine in the trauma ward, and ancillary service offered, one-stop crisis center, code blue team, and trauma ward. Department of Pharmacy. Department of Pharmacy was set up in 1967, which is to supply medication. Department of Pharmacy supply medication for hospital patients, and the service back then were provided by pharmacy store. The patient is dispensary and the creams, ointment, compounding facility. They also have cream, not just medicine, also cream, ointment or compounding facility. Okay. The Department of Pharmacy consists of Diagnostic Laboratory Service Unit (UPMD), was established in 2015. Okay, next is Dietetic Department. Okay, Dietetic Department also. UMMC also provide a dietetic department because the dietetic department is a clinical support unit which provides medical nutritional therapy for the patient. Medical nutritional therapy is a combination of nutritional intervention which includes nutritional, medical and behavioral science, which is to give positive impact to the health and wellness of patients. Okay, next one is Biomedical Imaging Department, which is located at UMC. As we went there before, it is located at Menara Selatan, level 5, which they consist of a general X-ray room. They have 6 rooms for general X-ray, and then for ultrasound they have 5 rooms for ultrasound, and then mammography they have 2 rooms for mammography. So for the X-ray, general X-ray, they still use CR, and also most of the rooms are using DR, which is digital radiography. The difference between CR and DR, CR is still using a physical cassette, which still need to go to process the cassette, but the DR is all a digital function that once the patient finishes the procedure, the image is automatically visualized on the physician's monitor. And then UMC also have MRI, which is located at ground floor, and they have also CT scan. They have 2 rooms for CT scan.
Hi, my name is Muhammad Azri. So I represent the Department of Rehabilitation. For the Department of Rehabilitation is some part of the clinical support for the UUMC. So there are several part of the service that provided in the Department of Rehabilitation, such as occupational therapy, physiotherapy, speech therapy, prosthetics and orthotics workshop, and rehabilitation technology, and also wheelchair workshop and others. So in the occupational rehabilitation, please scroll the slide. The rehabilitation is focused on the disabilities individuals in treating injury, illnesses, disability and ill health in order to achieve productive life and independent and a meaningful life. The treatment is shaped adjunctive modalities, therapeutic activities, and sensory integration and others. For the next is physiotherapy. In the physiotherapy department is focused on how to maintain and secure movement and function of the body to potential patients to achieve the maximum level in daily life. So physiotherapy treatment methods to control or to resolve symptoms or problems faced by the patients. There are many services that in the physiotherapy department, such as manual therapy, therapeutic exercise, and many more. For the speech therapy, it consists of screening and evaluation tests of language, speech, identify, create, and diagnose the intervention on individual who suffer from speech disorder. So the service that provided, such as evaluation and control of language disorders, speech and communication. The second, evaluation and control of language disorders, and the last one is evaluation and control of swallowing problem, which is an assessment of swallowing disorder. Okay, next is wheelchair service professional. For the wheelchair services professional, is service for an adult and pediatric wheelchair user. So the service that provide is the assessment and review of complex wheelchair needs, the prescription wheelchairs, and they also provide advice for professionals and users or caregivers regarding the complex wheelchairs. For the non-clinical department, we have the Department of Information Technology. This department is heart and brain of UMMC's Information and Communication Technology. It playing as a major role in providing ICT and committed to ICT excellence to the demands not only to clinical area but non-clinical area as well, in the aspect of application and development, networking, training, policy, securities, and others. So, information technology have emerged technology in educational hospital growth, increasingly complex and requires new interpretation. So the roles and responsibility of the Department of Information Technology is responsible to first level troubleshooting and system resolution, maintain data center standards and policies. Next, maintain or take backup and restores, maintain different type of database, and maintain a working knowledge of critical system. They also they identify, investigate, and involve user, and provide controls, provide access to the data centers of all firm staff, vendors, and third-party technicians. The system in the UMMC, they use help information management systems such as Pusat, EMR. EMR is the medical record system which facilitates the transfer and sharing of patient information. Next, they also use MORIS. MORIS is the identification database system that can scan, recognize, and identify the individual based on iris, facial, and fingerprint. The next is lab center, and the last one is PACS. PACS is medical imaging technology which provides economical storage, retrieval, and presentation of medical image. Nowadays, there also the UMLC have the new innovation such as a new technology to treat lung cancer patients. They are offering a painless, cost-effective, and shorter hospital stay in their hospital. Patients who have lung cancer will go on a surgery that is just innovated, which is known as unepileptic video-assisted thoracoscopic surgery, VATS. It is a technique that allows a small hole about 3 centimeters, which is less painful than conventional surgery. So, with the new innovation, patient can recover faster and start the next line of treatment earlier. So this is the news about the new technology. Then, UAMC have their vision and vision that allows, shows their true aim, that what will and want to be in the future. The organizational chart shows that their top management of the hospital that directs the hospital to achieve its vision and mission. So it is important because nowadays IT infrastructure are growing rapidly. titanium servers, blade servers, and rack mounted servers. So I think that's all from